confirm your appointment. Hi, I'm calling from Clinica Esperanza. Jennifer from Whole Clinic, Clinica Esperanza, to confirm your appointment for...
Oh, Clinica Esperanza. We named it after Hope. Hope is, Rhode Island. We're here because Rhode Island experienced one of the worst recessions it's experienced in many years. The people who fell through the cracks are our patients. They are the hardworking poor of Providence, people who cobble together 2 or 3 jobs to make ends meet. And those are the people who don't have health care because their part-time jobs or the jobs that they have full-time don't provide them with health care. So they're hardworking members of our community. This is their safety net. That's why we're here. We operate on altruism. So we have physicians, nurses, nurse practitioners, administrators, high school students, college students. Everyone comes to this clinic because they want to give back. And one of the problems that we have is that altruism doesn't pay the bills. We have to pay rent. We have to pay for a nurse. That's our Department of Health requirement. Nobody takes altruism dollars for that.
Last year, students at Brown Medical School established a student-run clinic within Clinica Esperanza, and we have a physician who is Brown affiliated who comes and he's a supervising physician, and we were able to see some of the new patients that were on the waiting list. Why do you do the student clinic?
I do the student clinic because I think it is an amazing way to meet not only patients but other doctors. It's just such a unique experience. As a first-year medical student, we're told how to do things and what to ask, and we don't really get the opportunity to do so completely ourselves, and this is by far the best learning experience I've had all year. And the mentors we get are great. They're really hands-on, and I love the people that we've met.
My name is Rosa Roman. I'm one of the navegantes. I work over here in the Clinica of Esperanza, Hope Clinic. I go with the patients to Rhode Island Hospital. I apply free care for them. And when we be there, I take them there with all the information because they don't know how to speak English. And I stay with them. I interpret everything, the words, I talk to them, and I ask them for the information. I tell the person what they need, and I be there for them all the time, for blood tests, x-ray, if they have to do any other test of the body, I go with them. I be there since 9 o'clock, it could be to 12, all depends. And I feel happy helping them because they don't know what to do. Because when you don't know nothing of English, you take all this bunch of papers in your hands and you go now what? What's the next step? And here we are, right there for them.
All right. And when was the last time you saw her?
About the issue?
All the physicians are volunteer.
Okay.
And basically you want to be available and dedicate time to see patients who are in clinic. We try to make it into a primary care model where a physician is hooked up with the same patients. But for us to be able to do that, we need a good number of physicians who would be able to dedicate a small amount of their time, really. I think it's a wonderful place. I think it's a wonderful service to the community, and it's something that's needed and badly needed. Patients appreciate it, patients like it, and they show up. The patients are here. We could use more physicians and more support. I think if hopefully one of these days free clinics won't be necessary, but until that day I think we feel an important need in the community.
This is just a great experience. I have to say that one of the reasons that I work at this clinic and that I'm happy to volunteer here is that every day that I come into clinic, every week that I come into clinic, it's always a positive experience. There's something amazingly rejuvenating or something that creates hope just by working here. You just see so many people are struggling, and the ability to provide something to them that they don't have that I can give them, which is health care, is just huge. So that's why we're here, and that's why we need everyone's support to keep this clinic going.